Now, the UK Health Security Agency has said that 15 children under the age of 15 have now died of Strep A in the UK since September.
Well, illnesses caused by the virus include impetigo, scarlet fever and strep throat, which can normally be treated, of course, with a course of antibiotics.
Health authorities are now urging parents to catch the symptoms early and seek advice from your GP if you can get to see one.
Well, let's talk to Dr Anita Raja, who joins us now. Anita, good to see you this morning. I mean, you can understand the absolute concern here. In reality, how concerned should parents be?
See, if you talk about Strep A infections, most of them are going to be harmless, and there is going to be a slight sore throat, especially if we talk about scarlet fever. There could be a temperature with it, there could be headaches, there could be a rash that comes on your body, you could have a strawberry tongue. And of course, if you go and see a clinician, your GP, or any other healthcare professional, you would be given first-line antibiotics, which is a penicillin, if you're not allergic to penicillin, and it treats it. However, there is another form of Strep A, which is very invasive and can be a threat to life because it enters your bloodstream and causes septicemia, which can make you very, very unwell. Hence, it's very important that we know what we're looking out for. And if you are in doubt, please seek medical attention. Yes, it can be difficult to get a same-day appointment at your GP, but you've got the urgent treatment centers. You can dial 111, take your child to the nearest hospital. If in doubt, seek medical attention.
Usual is it to have deaths from Strep A? I mean, I wonder if we're just reporting it more because we're so health aware following COVID. Do you normally every year have deaths like this?
Well, the thing is that normally Strep A is not as life-threatening, but now there's an analogy behind this, and the analogy is that most of these children have had no human contact or very limited human contact for the past 2 years during the pandemic. Hence, their immunity has not had the chance to develop, whereas other children before the pandemic were exposed to all sorts of bacteria and viruses. Hence, they had the ability to fight them off. So I would say that, of course, there's going to be a case here and there where there is going to be death. But the most important thing here is that there is a problem at the moment. As you know, because of the Strep A outbreak, we now also have another huge problem. We have an amoxicillin, a penicillin shortage here in Birmingham specifically, where we are having problems sourcing the antibiotics. Hence, in some cases, we are now using second-line antibiotics like clarithromycin to treat this infection.
Is that a problem, using second-line antibiotics and things like erythromycin and things? Because if that's going to be effective, I'm just thinking what adds to the panic? And obviously you need to get the supplies in of what you need, but we don't need to add to the panic, do we?
I know, it's unbelievable. I mean, it's so frustrating, as you can imagine, as a clinician. You have these parents who are worried about their children, and then there's another worry that you won't get the antibiotics. But there's definitely nothing to worry about in terms of panicking. Clarithromycin is as good as penicillin. And in any case, if you'd be penicillin allergic, we wouldn't be giving you the penicillin. So you will get an antibiotic in the end, which is hopefully going to help.